Hi, I'm Dr. Robert Berry, and you want to learn a little bit about the cornea in case your doctor's ever talked to you about having a corneal transplant. Now, you've got to learn a little anatomy. The cornea is the front of the eye. It's the window that we look through. It's absolutely clear tissue. It has a wonderful nerve supply. It's the most sensitive part of your body. You can feel a hair in your eye. You can't even feel it between your fingers. It has somewhere between 200 and 600 times the nerve concentration of your fingers. Okay, so it's very sensitive, it's transparent, it has no blood supply, it gets its oxygen right out of the air and its nourishment from the thin soup that the eye makes all the time that circulates and touches the backside of the eye. What can go wrong with the cornea? If it loses its clarity, that's the big problem. Now, how can that happen? Trauma, you can get cuts, burns, things like that. Chemical injuries, people get acid splashed in the eye, lye, things like that can damage the tissue and cause scarring. The scarring turns white. You can't see through it. You need a corneal transplant. Also, the inside of the cornea is lined with a thin layer of cells that pump fluid out of the cornea, pull it back into the eye. The cornea is a water sandwich. You've got tears on the outside, mostly water, and you've got aqueous humor, the thin soup inside the eye that's mostly water. And the cornea would like to swell. It's about 78% water. It would like to swell to 98% water, like a kitchen sponge, the kind you used to buy and put in the sink and it would swell up. The endothelium, epithelium outside, endothelium inside, the endothelium pumps water out of the cornea day and night from before you're born till about 24 hours after you're dead. It doesn't know you're dead. It doesn't have a blood supply, so it doesn't realize that you've died. So you can be a donor. We can take your cornea with your endothelium and put it in someone else who needs a new cornea or whose endothelium has worn out, either through disease, inherited disease. Fuchs dystrophy is one that's very common. Oh, a fair percentage of the corneas done in this country are done for Fuchs dystrophy, which is an accelerated wearing out of the endothelium. The endothelium wears out in all of us, but we have such a reserve that it would last well over 100 years, and not many of us make it that far. So in a normal person who's never had any trauma, never had any surgery, the cornea stays clear usually for a long, long time, much longer than we need it. And you can always loan it to somebody else. If the endothelium goes bad, wears out, has an inherited dystrophy problem, then we can transplant either the entire cornea, carrying the endothelium on the inside, or we can take the donor cornea and slice off the endothelium, fold it up, make a little incision in the side of your eye, put it inside, unfold it, and put it up against the inside of your own cornea. If the meat of the cornea is clear and the only worn out part is the endothelium, we can replace just the endothelium. There are two ways to do it. They're basically the same. One's called a Decimase stripping endothelial keratoplasty. One's called a Decimase membrane endothelial keratoplasty. The difference is not remarkable, but in essence, you're replacing the endothelium and leaving the patient's own cornea, 99% of it, intact. You only take off the bad portion, the inner layer of cells. It's a delicate operation. That particular one where you replace the inside is new. It's not been done in this country very long, but it has become one of our more frequent corneal transplant operations now because it is so much of an improvement over the older full thickness corneal transplant. We still do those when the meat of the cornea, the clear tissue, is scarred. Replacing the endothelium doesn't help. You have to replace the whole cornea.